In the U.S., there are 15 confirmed cases, with 8 of them in California, of coronavirus. So what are hospitals doing to prevent the spread in major metropolitan cities? Well, let's bring in Dr. Bernard Camins, Medical Director for Infection Prevention at Mount Sinai. Doctor, thanks for joining us today.
Thank you for having me here.
How is the Mount Sinai system preparing, and what would you expect? What would worst-case scenario actually look like? How are you preparing for it?
So, actually, we've been preparing for years, right? Ebola taught us a big lesson back in 2014, 2015. And there was also Middle Eastern respiratory syndrome called MERS, and that also came out in 2012. So part of our routine is actually we screen patients by asking questions about travel history and symptoms every time they come in to the health system. These are standard questions that were actually recommended by the CDC. And so we have adopted the mantra from our public health officials of identify, isolate, inform, meaning you identify potential cases, you isolate them right away, and then you call infection prevention, which I'm part of the team, and also the public health officials to then decide what to do next after you identify a patient.
So you're an infectious disease specialist. Why do you think there hasn't been more of a spread in this country? If what we understand about this disease is that it is so contagious, there's a very long sort of incubation period, and we've had people travel from Wuhan to the United States where they have the disease.
I think that we started screening travelers at the airports and a lot earlier, and so maybe, and then I guess now that we have a travel ban, that has also helped as well. So, but I think what the experts are saying right now is that there's a potential that this will be part of a circulating viruses anyway, and that it may not go away at all and will be part of our usual viruses that potentially can reoccur again in the wintertime, very much like the flu virus.
How much of a concern is Singapore, given the fact that we're seeing more cases there? You don't have the same sort of travel bans. Is that something that, I guess the U.S., for example, is on high alert around, or that doctors like yourself would be on high alert around?
I think everybody in the world is on high alert. I think that they didn't have as strict of a travel ban until today. I think I saw an update that they were going to have a similar travel ban that we have in this country. And I think part of it is because they had an increase in the number of cases. For a small country, they do have a lot of cases, So I think that they are increasing their travel ban just to prevent new cases from coming in.